The former director of the largest U.S. stockpile of medical supplies tells us there is not enough inventory to meet the needs of the doctors and the nurses. The U.S. has already dipped into the strategic national stockpile. Catherine Herridge spoke with Greg Burel about that.
The system is very stressed.
Greg Burel retired in January after 12 years as head of the Strategic National Stockpile, the nation's $8 billion supply of medical equipment, drugs, and protective gear.
Can the stockpile support the needs of American hospitals?
The Strategic National Stockpile is that very last lifeline. It doesn't have everything and unlimited resources that people would like it to have.
The U.S. began tapping that lifeline earlier this month, shipping supplies across the country from government warehouses. Their locations kept secret for national security reasons, with officials providing CBS News this recent video.
It would never have been possible, even with virtually unlimited funds, to supply everything that's going to be needed for this event from the Strategic National Stockpile.
The stockpile's biggest deficit may be ventilators. An official with Health and Human Services confirmed to CBS News there were 16,600 ventilators before COVID-19. Now there are thousands less, as officials anticipate a surge of new cases.
Ventilators are very expensive to purchase, so it's not just the question of buying one of these many $1,000 pieces of equipment, but also how to package that correctly so it can be used quickly, and to keep those in good shape by sending them back for regular maintenance. It's a very expensive proposition, a heavy lift.
Another complication. In response to the 2009 H1N1 pandemic, the stockpile deployed nearly 20 million pieces of personal protective equipment and 85 million N95 masks.
We didn't receive funds to replace those masks, protective gear, and the antivirals that we use for H1N1.
While the new stimulus package earmarked $16 billion for the national stockpile, Burel says he's still on edge.
My concern going forward is it's going to be hard to prepare for a second wave or for a future need in this area. So while the supplemental appropriations Congress has provided are wonderful, the question is, how do we sustain that further investment for the future?
In a statement to CBS News, a spokesperson for Health and Human Services said they've made several targeted purchases of protective gear, and with additional testing, officials determined some older masks and surgical gowns are still good to use. On the lack of ventilators, the FDA issued an emergency use authorization that allows certain devices, including anesthesia gas machines, to be modified and used as ventilators in healthcare settings. Tony.
Whatever it takes, Catherine. Catherine, thank you very much.